The date is Friday, March 13. This is the news on PBCJ. I am Simone Absalom. Jamaica has confirmed 6 new cases of the coronavirus 2019 COVID-19 on the island. The cases, which bring to 8 the number of confirmed cases, include 2 males aged 63 and 67 who came into the island on March 7 from Trinidad, having traveled from Malaysia by way of Dubai and London. They presented at hospital on March 11. 1 male, 36 years old, who traveled from Manchester, England. He was taken to hospital from his hotel via ambulance on March 11. 1 male, 31 years old, a Jamaican overseas ship worker who came into the island from the Canary Islands via Portugal and Miami. He arrived in the island on February 25 and presented to hospital with symptoms on March 10. 1 male, 58, who is the father of the first patient who was confirmed with COVID-19. He was discovered ill at home on March 11. And 1 female aged 34, who is a close contact also of the first patient who was confirmed with COVID-19 on the island. The Minister of Health and Wellness, Dr. Christopher Tufton, met with the media on Friday afternoon to provide further details. He is currently examining the level of preparedness for COVID-19 in Western Jamaica. The Ministry of Health and Wellness wishes to inform the public that the first patient who tested positive for COVID-19 attended the funeral of the late Gloria Clark, held on Saturday, March 7, 2020. And the interment was followed at the Meadowrest Memorial Gardens. The ministry is asking all persons who attended the funeral service and/or the burial to make contact by calling any of the following numbers: 888-1-LOVE. That's 888-663-5683 or 888-754-7792 or 876-542-5998, 876-542-6007, or 876-542-6006. Also, 876-542-5998. Persons may also send an email with their contact details to covid19@moh.gov.jm or covid19facts@gmail.com. That's covid19facts@gmail.com. Finance Minister Dr. Nigel Clark says there is no need to panic over the possible economic fallout due to the COVID-19 cases in Jamaica. Dr. Clark says tax revenue remains ahead of target and efforts are being made to maintain the level of liquidity in the market. He says major players in the manufacturing and distribution industry have reported that they have up to 3 months of inventory of food and other essential supplies, so there is no need to panic.
In the meeting this morning, we'd have had persons, as I mentioned, from the Manufacturers and Exporters Association and representatives of the distributive trade. And we were updated that inventories remain strong, and so there's no need to panic. The large sort of players in that industry, in the manufacturing and distribution space, report that they have 3 months of inventory for major items of food and other essential supplies. So there's no need to panic. There's adequate inventory.
The finance minister also says efforts will be made to prevent job losses, particularly in the hotel, restaurant and attractions industry. He was speaking at a news briefing at Jamaica House on Thursday morning with senior economic advisors, the central bank governor and members of the private sector to assess the state of the economy. Meanwhile, Dr. Clark also announced that the deadline for the filing of tax returns has been extended from March 16 to March 25.
The Taxation Jamaica is going to announce officially later today that the last date to file income tax is supposed to be on Monday, the 16th of March. Given the dislocation that this event or the news of the COVID virus is causing, the Taxation Jamaica will move that date down, and they will announce that officially.
The primary exit profile performance task tests scheduled for March 19 and 20 have been postponed. These exams would have fallen within the 14-day school closure program announced by Prime Minister Andrew Holness at a press conference at Jamaica House. The decision to close all public schools was taken after consultation with the Ministry of Education, Youth and Information and will be reviewed after 10 days.
We are currently reviewing the schedule for PEP. The ministry has the capacity to postpone this assessment and to make a determination later depending on the number of days that the students are going to be out. So we will assess after the next 14 days, and based on what happened then we will or may take a decision for the postponement of the assessments to take place in April. We are committed, however, to ensuring that whatever happens, that the students will get an opportunity to sit, and in cases where they are not able to sit all 3 sets of papers, we have already done 1, and we have their grade 5 assessments that could also be utilized in this specific case.
Grade 5 students are scheduled to do the performance task on May 28 and May 29, and grade 4 students are scheduled to do PEP performance task tests on June 25 and 26. Effective Monday, March 16, all external visits to correctional facilities will be suspended for 2 weeks as part of its COVID-19 prevention plan to decrease the likelihood of the spread of the virus within facilities island-wide. The Department of Correctional Services says during this period, the public will not be allowed to take food or care packages to correctional centers. It said probation aftercare offices will still be operational. However, walk-in visits to these locations have been suspended. These suspensions will be reviewed at the end of the 2 weeks. Over 4,000 inmates are currently housed at correctional facilities island-wide. And steps are being taken to institute the requisite safeguards within court spaces and other sensitive areas of the judicial system in light of the onset of the coronavirus in Jamaica. So says Chief Justice Brian Sykes. The Chief Justice says there is no need to fear coming to or gathering in the courts. He says the Court Administration Division has provided the staff with sufficient resources to assist them in protecting themselves from contracting the virus and keeping court spaces adequately sanitized. Nonetheless, Sykes urged staff and members of the public using the court to take personal responsibility for protecting themselves. The Jamaican Consulate General in New York, which serves the largest diaspora community, will be closed from March 16 to 20 amid the coronavirus outbreak. Speaking at a press conference Thursday, Foreign Affairs Minister Kamina Johnson-Smith said the consular departments in Washington, D.C. and London in the United Kingdom will also be closed over the same period.
This is a precautionary measure to protect persons from spreading the virus by limiting nationals having to gather to access services in person and, of course, the transit to our relevant missions. Instead, we're recommending the use of online passport and mail-in applications, as well as other services, and the use of telephone inquiries where appropriate. During this initial period, the situation will be further assessed, as I indicated earlier, for further adjustments as may be required for the operations. In respect of staggered hours, we have approved staggered hours for missions where staff take public transportation and there's been an outbreak. And this is this is intended to ensure that they don't have to be confined during rush hours in close proximity, given the risks at play.
The government is also encouraging Jamaicans in the diaspora to postpone non-essential travel to the island.
We've also extended to all overseas staff the Government of Jamaica restriction on travel. All staff have been advised that no travel will be approved at this time for non-essential purposes until further notice.
In other local news, opposition spokesman on finance Mark Golding says there is nothing in the government's economic policy that would make real changes in the coalition or condition of poor Jamaicans. The opposition spokesman questioned the fairness and effectiveness of the government's tax break policy announced by Dr. Clark on Tuesday.
In April 2017, the Planning Institute of Jamaica issued a report on the likely impact of the government's shift to greater indirect taxation. That report indicated that poverty would be worsened by the government's tax policy of removing $30 billion in 2 years of direct taxation from the incomes of persons earning over $600,000 per annum and replacing it with various forms of indirect taxation totaling over $30 billion, borne by the general population of Jamaica, including the poor. While indirect taxation has advantages in terms of ease of collectability, indirect taxation is also regressive. It disproportionately burdens lower income Jamaicans relative to the more well-off. For each dollar of their spending, they pay more tax as a result, each dollar of their income. It worsens inequality. Dr. Peter Phillips has consistently and stridently advocated for a 2% reduction in GCT. We are happy that at last the government has come on board, albeit with less than we were calling for. This 1.5 belongs to Dr. Peter Phillips. He called for it, he stuck with it, and he has won it for the Jamaican people.
He said that it is a relative few who are reaping profits from investments in the stock market and real estate.
Mr. Speaker, the government's approach will only worsen the division of Jamaican society into the haves and have-nots. It is relatively few who are reaping profits from investments in the stock market and real estate, and who are seen enjoying life at the restaurants and entertainment spots uptown. On the other hand, the working poor, the pensioners and unemployed are increasingly left behind by a model of development that marginalizes the majority.
In his opening contribution to the budget debate on Tuesday, Finance Minister Dr. Nigel Clark, a former company director and businessman, admitted that there is a significant number of vulnerable persons in the Jamaican society without social protection.
Something I'm very proud of and something that's dear to my heart, the introduction of a social pension for elderly Jamaicans, many of whom have worked all their life, but due to no fault of their own, were excluded from, well, are not in receipt of an NIS pension, don't qualify for a PATH grant. And this social pension is to recognize that need in our society and to address a long-standing structural inequity.
The debate continues next Tuesday with leader of the opposition, Dr. Peter Phillips, making his presentation. And of course, the PBCJ will be carrying the procedures live on the television station as well as our social media platforms. Scotia Group Jamaica is reporting reduced net income of Jamaican $1.7 billion for the 3 months ended January 31, 2020, compared to $2.32 billion for the corresponding period last year. However, President and Chief Executive Officer of Scotia Group, David Noel, says they continue to see strong growth in their core business. The US dollar is being traded at 136 Jamaican dollars 27 cents, up by 56 cents. That's according to the Bank of Jamaica's daily exchange trading summary. The Canadian dollar is being traded at $98.68, up from $98.48, while the British pound sterling is being traded at $173.48, down from $176.32. In regional news, CARICOM Chairman Prime Minister Mia Mottley of Barbados and 4 other Prime Ministers paid a 2-day visit to Guyana to meet with elections stakeholders following the country's March 2 general elections. The other Prime Ministers included Dominica, Grenada, St. Vincent and the Grenadines, Trinidad and Tobago. CARICOM Secretary General Erwin Larocque was also present. The counting and declaration of polls has been marred by what observers call a lack of transparency, especially as it regards to Region 4. This prompted the CARICOM visit. Ms. Motley spoke at a press conference on Thursday in Georgetown.
As you can see, 5 prime ministers of the community visited Guyana yesterday, and we had a series of meetings with different parties. We met with the president, and we met with the executive of APNU. We met with the leader of the opposition, Barrett Jagdeo, as well as the members and the presidential candidate, Mr. Irfan Ali, and other members of the executive of PPP. We also met with the representatives of the small parties. We met with the election observers. And then again, we met with the president and Mr. Jagdeo very late last night, early into the morning, together in order to be able to chart a process forward. We, the leaders of the Caribbean community, are committed to working with the people of Guyana for a free and fair process and transparent process. And we made it clear because there is simply too much at stake for the people of Guyana. Georgetown is the home, the seat of the Caribbean community.
The Caribbean community leader, however, made it clear that ultimately the outcome of the elections has to be decided by Guyana and not by outside intervention.
We are clear that as a community of sovereign nations, we cannot get involved in the internal processes, but we are family, and family does not stand by and watch others in the family suffer without making themselves available to be able to aid the process. We've tried to do that, but we are also conscious that we will be as successful as the parties themselves want it to be successful, and that while we can create the space for them to speak, they have to have the will for this to work. There is no doubt in our minds that there is at stake far more than who will be the president of Guyana. What is at stake is also the lives and the stability of the people of Guyana.
On Thursday, Acting Chief Justice Roxanne George Wiltshire nullified the earlier declaration by the returning officer for Region 4, ruling that his declaration was unlawful and ordered the tabulation process be resumed.
The Chief Justice of Guyana ruled yesterday, and her ruling was absolutely clear that she expects the returning officer to either start anew or complete the process with respect to the SOPs. And we hope and pray that there will be an adherence to not just the law of the judgment, but to the spirit of the judgment, because she was very clear in the last few paragraphs of her judgment as to what she expected in terms of the spirit and the principled position and the transparent process that is critical if this country is to go forward.
In the meantime, Guyana's President David Granger said he welcomed the visit to his country by CARICOM member states in light of concerns over undeclared election results from the March 2 polls.
The 5 prime ministers, Barbados, Dominica, Trinidad, Tobago, St. Vincent and the Grenadines, came to Guyana, and they were earnest. They were committed to working with Guyana and the stakeholders in Georgetown and the rest of the country to craft a path forward out of the present situation. And they were non-intrusive. They engaged the government, of course, and the parties in the governing coalition. They engaged the leader of the opposition. They engaged the observer missions and other stakeholders. In fact, at night, you may not know this, but we had meetings up to 1:30 in the morning of Thursday morning. So they were fully engaged. They worked very hard and aimed at getting a solution to the present situation. I would say it was successful.
Mr. Granger also commented on the ruling from Acting Chief Justice Roxanne George Wiltshire.
On Thursday, the two sides, the government side and the opposition side of the Elections Commission, would meet and work out some way of implementing fully the ruling of Chief Justice Roxanne George. I think that was the high point of the CARICOM engagement, that the two sides, opposition leader Barrett Jagdeo and President David Granger, arrived at an agreement that the process should remain in the Elections Commission. The Elections Commission should meet and decide how it would implement the Chief Justice's ruling.
Still in news from Guyana, some 14 doctors and nurses at a hospital in Georgetown are now in self-imposed isolation following the death of a patient on Tuesday from COVID-19. News source Guyana's Gordon Mosley reports.
Over 14 doctors and nurses at the Georgetown Hospital were placed into self-quarantine following the death of that 52-year-old woman at the hospital from the coronavirus. They will remain quarantined for 14 days, in keeping with the protocols of the World Health Organization. Public Health Minister Valda Lawrence this morning confirmed the quarantine of the health workers and said family members of the dead woman and others who may have been exposed have also been ordered into self-quarantine.
As I said, there are several protocols that we have to follow, and so we began the mapping last evening, and that's why many of us, we were there until very late into the morning. There are set protocols for every stage of this pandemic. And so what we're doing is not only family members, but everyone who has been in contact or in close proximity, we have been able to map, and so it is now for the execution of that. But we are not going to speak about the family members and the persons whom we will call in, and so we're not going to do that. Yeah. We are going to ensure that we give people their privacy and the respect that is due to them. And we are going to ensure that we do our work, and we do it very diligently and respectfully.
During that interview at 94.1 this morning, the Public Health Minister said the Public Health Ministry has put all systems in place to address the situation. She said the absence of those health workers now in quarantine will have an impact on the operations of the Georgetown Hospital. But the Public Health Ministry is serious about safeguarding its workers and other persons that they might be in contact with. The Ministry of Public Health has set up a hotline for persons to call if they believe they have symptoms of the coronavirus or may have questions. The numbers to call are 227-4986 or 624-3067. The Public Health Minister also said persons need to be truthful with information that they provide to health professionals during visits.
It was not until after when further information was given, that the decision to test was made immediately. And so I think this is a big shout out to everyone. You have to give accurate information. And so the result of that, of course, there would be a decontamination exercise done within the A&E department to ensure that the place is fully sanitized and so on, so that business can continue as usual. We can offer those services to persons.
News source understands that the family of the woman who died only informed the doctors of her travel history after she passed away. She was in the hospital's accident and emergency unit for more than 12 hours, being treated for respiratory symptoms and hypertension. Minister Lawrence said citizens must understand that addressing the coronavirus is a national issue, and it is not time for kicks or attempts to make it a political issue.
And I'm asking people, this is not a political matter. This is a national matter. Because even yesterday, as we discovered our first case, St. Vincent discovered their first case. Cuba came up with 3 cases. And the list goes on. There was a surge in this part of the world, in this region, the region of the Americas. And so let us be very, very careful about this. I see people putting all sorts of fake things on the social media, and I'm asking you to desist from it because you don't want to fall prey to this.
The Minister of Health, Terence Deyalsingh, has confirmed the first case of COVID-19 in Trinidad and Tobago. The patient was identified as a 52-year-old male who flew into Trinidad and Tobago from Switzerland. This person has been in self-isolation.
At 2:45 today, we got confirmation of our first case of coronavirus from CARFA. Let me give you a brief history of what has happened so far. This case, should be noted, is an imported case. It's a 52-year-old male who flew into the country from Switzerland on Monday, the 9th of March, that is this Monday. It is worthwhile to know that since Monday, this person has been in self-isolation. The person would have contacted his healthcare professional on Wednesday, the 11th, which is yesterday. The necessary swabs were taken, and CARFA today at 2:45 p.m. contacted me and said we have our first confirmed case of COVID-19. What have we done so far since we were alerted about this possible case? As I said, he came in on Monday night. The family has been in isolation since we were alerted, since Wednesday the 11th. Contact tracing began on Wednesday, already begun, under the protocols that we use for tuberculosis. This is being conducted by Dr. Michelle Trotman of the Cora Hospital as a matter of course. So contact tracing began on Wednesday. It is a mild case, so now arrangements are being made to have the patient transferred from his home via suitably equipped ambulance services with all PPE to the Cora facility, as it is a mild case.
In sports, Reggae Girls defender Alison Swaby has fled coronavirus-ridden Italy and is now back home in the United States, where the deadly disease is also making an impact on its global rampage. The American-born 23-year-old who plays for women's Serie A club AS Roma told the Jamaica Observer on Wednesday that she made the decision to leave Italy just in time before authorities in the country tightened restrictions on the ports and urged its 60 million citizens not to travel. More than 12,000 people in the South Central European nation were confirmed to be infected with the COVID-19, with over 800 deaths. And still on football, reggae boy Leon Bailey scored his first goal in the UEFA Europa League this season on Thursday. His team, Bayer Leverkusen, defeated Scottish club Rangers FC 3-1 in the first leg of their round of 16 tie in Glasgow on Thursday. Bailey, who came on as second-half substitute, scored in the 88th minute for his team to secure a 2-goal lead heading back to Germany. CONCACAF will be suspending the quarterfinals of the Champions League until further notice. In a release on Thursday, the governing body of football in the region stated that due to COVID-19, the coronavirus, it will be monitoring all CONCACAF-related competitions and advise on their plans in due course. And that's the news on PBCJ. Thank you so much for watching. Keep watching PBCJ. We are the People's Station, and we'll be giving you updates on the virus as it develops.